friend of mine, and he gave me a call. He said, listen, I've got pain in the chest. You're a cardiologist. Is this something serious? Can I relax? I said, it sounds serious. Tell me about it. I listened to it. I said, okay, fine. Where are you? Meru. Excellent. You're in Meru. Perfect. Find an ECG. Send it to me. We have technology now. WhatsApp. So the ECG is supposed to be done within 10 minutes. I didn't get the ECG. I got a text message, WhatsApp message about 9 hours later saying they don't have an ECG machine that's functioning at the moment.
Between 2008 and 2010, we analyzed our patients. One of the critical questions was, from the moment you experienced chest pain, how long did it take you to come to hospital? Now the standard out there is about maybe 1 hour or even 2 hours. But in Kenya we're seeing that it took 12 hours for the patient to recognize, to come from the time they developed their symptoms to the time they presented to hospital.
We are looking at ways in which we can help a patient survive that experience.
If we're looking at standards, what's been said is important, so time is of the essence. So we aim to get treatment as quickly as possible, and that treatment doesn't have to come from a cardiologist, doesn't have to come from even a doctor. So you can empower your networks and your healthcare professionals within different regions to deliver the right treatment.
A heart attack occurs because an artery, the blood vessel that is sending blood to the heart, gets blocked, and that means that the section of the heart that's depending on that blood supply gets starved of oxygen and food, and within minutes that part of the heart will start to suffer injury, and eventually, if it is not unblocked, the section of the heart will actually die.
How do we come up with solutions now that will impact that person in a village who gets a heart attack? How do we get him optimal care? How do you do that? The mechanism will be, of course, to get all stakeholders together, from the citizens to policymakers to industry, private citizens, come together and come up with ways in which we can approximate for everybody the care that somebody living around Nairobi can get.
I had a heart attack on the 2nd of January. I never saw it coming. I play squash, I play tennis, I've played cricket, I've played hockey, and I thought I would never get this one, but it came. And the other thing what they said was that, like people recognize it late. Even when I had the chest pain about a few days before, I thought I was getting a heartburn or I'd eaten something bad. So I could have come into hospital about 3 or 4 days before, and I could have been picked up without having any damage to my heart. But luckily I chose the right day to get the heart attack, the 2nd of January. There was no traffic. I reached the hospital in 15 minutes. I look back now, from the time I landed in hospital, within 10 minutes, my ECG, everything was done. We found out there was a heart attack. Somebody in the hospital took a photograph with their camera, and they sent it to Dr. Gillen, who was just going for a jog in the morning. So he didn't go for the jog, obviously. He came to the hospital. So what they did for me was, this is the place where they put in a needle and they go into the heart, and then they put the dye and they found out what was blocked. And one of my arteries was 90% blocked. Dr. Gillen just put in a stent, and within, I think from the time I landed in casualty at Aga Khan Hospital to the time the stent was put was about 45 minutes, which is I think a world record. Kenyans are good at world records. So like after 2 hours I was fine. After 2 days I was discharged, and I had my cardiac rehab and all. So it's a very positive, As a patient, I can say that I got access to world-class care here in Nairobi.